Hi, I'm Dr. Tay Tunn Lin. I'm a Senior Consultant Endocrinologist from the Livingstone Endocrine Diabetes and Thyroid Clinic. I specialize in the treatment of diabetes and thyroid disorders, and today I'll be sharing a little bit more about my profession as an endocrinologist. An endocrinologist is a doctor who specializes in the diagnosis and treatment of hormone-related diseases and conditions. We have specialized training in the endocrine system, and we can help diagnose, treat, and manage the illnesses that arise when hormone imbalances or endocrine gland problems occur. My two main areas of specialty are treating diabetes and thyroid problems, as they are one of the most common endocrine disorders. With rising prevalence over the past decade, there are over 400,000 people with diabetes in Singapore, with 1 in 3 not even aware that he or she has diabetes. Of those who do, 1 in 3 has poor control of it. Diabetes now costs Singapore over $1 billion a year to manage and is one of the leading causes of hospitalizations, amputations, kidney failure, and even deaths. This is why proper management is important, as it can be kept well under control so that patient continues to lead a good quality of life. The thyroid is an unassuming and often overlooked part of our body, and yet it holds great importance in keeping many of our body's key processes in check, particularly our metabolism. Located at the base of the neck, the 5 cm butterfly-shaped gland releases hormones that primarily controls our body's metabolic rate. The thyroid gland is a part of the endocrine system, which comprises of numerous glands in the body that produce, stores, and release hormones into the bloodstream, which further distribute these vital hormones to the body cells to keep them functioning normally. Some of the most common endocrine problems are diabetes and thyroid disorders, osteoporosis, metabolic disorders like obesity, hypertension, and high cholesterol, excessive or insufficient production of hormones from the adrenals or the pituitary glands, as well as endocrine causes of infertility. Typically, you'll see an endocrinologist in the clinic after being referred by your primary care doctor. However, an endocrinologist could be called in to consult if you are admitted in hospital if there are concerns about an underlying hormone-related disorder. I usually see patients for reasons ranging from diabetes management to problems with their thyroid, salt imbalances, uncontrolled hypertension, and more. If you are suffering from any of these conditions, seeing an endocrinologist will help you manage your condition better with the right treatment. In the clinic, I will listen to what each patient's symptoms are and decide on the appropriate blood tests that need to be done. If necessary, certain scans for the thyroid, the pituitary gland, and the adrenal glands may be required to come to a diagnosis. In patients with diabetes and other metabolic conditions, I will go through with them on the best way to adjust their lifestyle, their diets, and to journey with them and help them adjust their medications along the way. The use of latest technology like the flash glucose meter or insulin pumps, where appropriate, will be introduced to patients as well. By partnering patients and with regular monitoring, the ultimate goal is to see healthy outcomes achieved.